Well, COVID-19 has touched various sectors of our society. This morning, we are talking pregnancy and safe delivery under the COVID-19 atmosphere. With us is consultant obstetrician and gynecologist, Dr. Andrea Griffith-Bowe. Dr. Bowe, welcome to the morning edition.
Morning.
I think the first things first, are pregnant women more at risk for COVID-19?
I guess we have to understand that the data that we currently have access to is basically based on a few months of experience with COVID-19. And robust data is generally based on millions and millions of cases. So from what we can see from the cases thus far, pregnant women are no more at risk than non-pregnant women for coronavirus infection.
Well, that's a good thing for them to know there. What are the symptoms in pregnant women, though, in terms of COVID-19, if they were to contract it?
Excellent question. So basically the symptoms of COVID-19 in pregnancy are identical to those of the non-pregnant women. So basically you're looking at primarily the milder symptoms, the cold, the cough, the fever, runny nose, the shortness of breath, and they have recently added nausea, vomiting, diarrhea, loss of taste, as well as loss of smell to the characteristics of the presentation of cases. And so for the most part, pregnant women, the majority of pregnant women will present with mild symptoms as per the general population. So for the most part, they would have mild symptoms. About 15% or so would have moderate symptoms, and less than 5% will have the more severe symptoms. So typically, the presentation mirrors that of the general population for the pregnant women.
What are the risks to a baby if the mother were to contract COVID-19? Can the baby be infected before delivery?
Correct. Well, at this time, we're building our knowledge base. And we have very few or limited series being published with regards to pregnancy and COVID-19. The majority of the series suggests that there is no transmission from the mother to the unborn infant. However, there are a few small series, limited series, that suggest maybe they would have had maybe 2 or 3 infants that might have been infected during the pregnancy. But for the most part, the advice that we're giving to pregnant mothers is that it seems less likely that the infant can be infected during the pregnancy. It is more likely that the infant could be exposed to the mother during her process of caring for the infant, for example, during breastfeeding and sanitizing the infant, etc.
On that note, then, what precautionary measures should a new mother be taking?
So moms should sanitize their hands, wash their hands as advised for 20 seconds with soap prior to caring for the infant. And this is prior to cleaning the infant, dressing the infant, breastfeeding the infant. Prior to pumping any breast milk, the breast pump should be sanitized, cleaned thoroughly, and it should be cleaned immediately after use. It's also advised that mothers should wear a mask if possible during breastfeeding to avoid the exposure of the infant to her respiratory droplets.
Well, we'll continue our discussion tomorrow, but what are those key areas we should be highlighting for pregnant women?
It is very important for pregnant women to try to maintain a healthy pregnancy, maintain good nutritional status, a good healthy diet, to get as much exercise that she can within the limited confines of her environs. It's important to continually to avoid the unhealthy things that pregnant women typically would avoid in pregnancy, like alcohol and tobacco. It's important that the pregnant mother does not subject herself to too much undue stress. It's important that she remain in communication with her healthcare provider so that she can get updated with the data as it comes to us. We will give it to our patients. And it's also important for pregnant women to follow the general guidelines of social distancing, cough hygiene, and hand hygiene.
And I'm sure that applies in bringing home a new baby as well.
Absolutely, even more important.
Well, thanks so much. And once again, that was Dr. Griffith-Bowe joining us on the morning edition. Dr. Bowe, thanks so much for joining us.